Hi, welcome to this model on designing health behavior change interventions using the behavior change wheel. I'm Marta Marques. I'm an assistant professor at the National School of Public Health in the Nova University of Lisbon in Portugal, and I'm also an associate for the Center for Behavior Change at University College London in UK. Just start with a brief land acknowledgement, and also by listing the partners of this initiative. So in this short model, we will cover the behavior change wheel framework as one of the frameworks that you have access to as a tool you can use in the designing, implementation, and evaluation of health behavior change interventions. Because this is a short model, we'll be looking at core principles and steps, and then we will have access to a list of resources for further readings and for a more in-depth learning about the framework. We will also address how we can assess barriers and facilitators to change. And specifically, we will talk about the COMBI model, which is the model that is in the art of behavior change wheel framework. We will then talk also briefly about identifying and selecting behavior change techniques, which are actually the strategies that you can put in practice to change behaviors. You have access to a list of learning objectives also on the module outline curriculum. And I'll just very briefly start by saying that when we're designing effective behavior change interventions, independently of the framework that you use, it is really important that you use a framework to support and to guide this process to ensure that you're using a standardized process that is evidence-based and will allow you to come up with the best and more effective behavior change intervention as possible. And the behavior change wheel framework and the COMBI model as a theory are two examples that we will address today. And I hope you will see the advantages and the unique aspects of using both this framework and this theory. The other aspect that is really important is to use standardized classification systems of the components of behavior change interventions. If you use a database that is available of the techniques that you can implement in practice, this will facilitate the process of identifying core behavior change techniques, select them, and learn on how to use them in practice. So the behavior change wheel, as I said, it's one of the frameworks that you can use in the development, implementation, and evaluation of intervention. And it's very useful in the first stages of designing an intervention. And I'll show you why. It is really important when we talk about the behavior change wheel to know that this is an interdisciplinary framework. Although it was developed mainly by psychologists, you might have heard about Professor Susan Mickey, who is a very well-known and prestigious behavioral scientist and health psychologist that was one of the key persons leading the development of the behavior change wheel. And although there were psychologists very heavily involved in the development of the behavior change wheel, the purpose was always to have a framework that is both interdisciplinary, so it has knowledge from different disciplines that come together into the framework, and also a multi-level approach. So it looks at change both from an individual, organizational, and population perspective. And it results from a synthesis of 19 frameworks. So the authors of the behavior change wheel started by doing a scoping review of frameworks that existed at the time to support the development and design of behavior change interventions. And from the synthesis of those 19 frameworks, the behavior change wheel was developed. And a core aspect of the behavior change wheel in comparison to the other frameworks that were available at the time is that the behavior change wheel puts behavior change, behavioral science, and theory at the center of the design of behavior change interventions. And if you look at the references provided below, you will find more information about the scoping review and the process of development of the behavior change wheel. So the behavior change wheel links interventions with models of behavior. And the idea is that you use whatever evidence is available to support this process. It is really important when we use the behavior change wheel framework or other frameworks that we don't use this as a recipe, as a prescription, but actually it is a guide to thinking. It is a tool to help you develop the intervention, to make it more standardized, but there's also freedom for creativity and to understand what fits better. The behavior change wheel can be used both to design intervention and policies for behavior change, but also to do a retrofit analysis of what was done in a given intervention or policy. So what were the main aspects that were developed? What were the core or target behaviors? What were the techniques that were implemented? What were the determinants that were targeted? What was missing and how we can improve it? There are plenty of examples in the literature of using the behavior change wheel to actually go back to existing intervention and policies and map them to the behavior change wheel to look at ways to improve them. It is also a framework for evaluation because it gives you the steps that, together with logic models that we usually use, can help you in doing a better evaluation of your intervention and thinking of the evaluation from step one. It is also used to support systematic reviews of evidence, and you will also find examples in the literature. And more broadly, it can also be used to help governments, local authorities, regional authorities in implementing better interventions to change behavior. And here in this slide, you have an example of a document that was developed by colleagues at the Center for Behavior Change to support Public Health England in using the behavior change wheel to achieve behavior change within their practices, so both local and regional and in national government. And here you have some examples of the use of the behavior change wheel across different behaviors. So either more focusing on the behavior change wheel as a whole, or looking more at specific aspects of the behavior change wheel, such as the COMBI model. So moving to the steps of the behavior change wheel. So the behavior change wheel has a wheel that has different layers. So there is inner layer that looks at what is in the heart of the behavior, and I'll show that next. And then there is a layer that looks at interventions, and there is a layer that looks at policy categories. And the idea of the behavior change wheel is that all these three layers are interconnected. So you can't select what you will do in a given intervention without analyzing what are the barriers and the facilitators to the behaviors that you want to change. And you also can't put this in practice if you don't look at the broader policy categories that need to be in place for the behavior to occur. And the behavior change wheel, what it tells us is that for us to do the interconnection between these different layers, we need to follow certain steps that will help us in developing the intervention and connecting things. So there are 4 steps that are part of the behavior change wheel. The first step is identifying what are the behaviors that we're trying to change. This means defining whatever is the problem and the needs in behavioral terms. Who does what, when, and where? And I will explain each of these steps briefly. The second step is about identifying what are the barriers and enablers or facilitators of the behavior. So what do we need to take to consideration? What do we need to change for the behavior to also change? And one of the models that is proposed within the behavior change wheel framework is the COMBI model. Once you have this behavioral diagnosis that results from step 1 and step 2, then you can move to the stage of identifying what are the different types of interventions that you can implement to change that behavior. So if you identify the barriers and the enablers, now what do you need to do in practice to change those barriers or to boost those enablers? And the last step that is linked with step 3 is to go into a bit more detail, so go in a more granular level to identify and selecting the specific behavior change techniques that you will use in practice and how you will deliver them. And for this, in addition to the behavior change wheel, we also use the taxonomy and more recently the ontology of behavior change techniques and also classification systems of aspects such as the mode of delivery of behavior change interventions. So as I mentioned before, the behavior change wheel has these 3 layers that you can see here, although it's in a very small size, but I'll show it again. And these steps will help you moving at the different levels of the layers within the behavior change wheel. For each of these steps, you need to implement different methods that will allow you to identify what is the behavior or behaviors you're trying to change, what are the barriers and facilitators to that specific behavior, what can I do in practice to change that behavior. To be able to gather this information, you need to implement the same methods that you would implement with any other framework and any other designing of intervention to change behavior. It's gathering evidence-based, both from the literature through systematic reviews, meta-analysis, but also through qualitative and quantitative methods of interviews, focus groups, questionnaires, whatever it is important in your own intervention to gather information from the target population that you're working with and stakeholders. And as you know, we are really moving in the direction of developing interventions and designing interventions that are really in co-creation with the target population and stakeholders. So it's really important that these methods are in practice to help us move in the different steps. So very briefly, step one, what behaviors are you trying to change? In the behavior change wheel, what you do is identifying what is the problem that we have now. There's an example here, increasing rates of obesity, what we want to achieve in the future, more people in a healthy weight range. So based on this, based on identifying what is the problem in behavioral terms, we can ask a few different questions, and these are just examples. What is the problem we're trying to change? What behavior are we trying to change in each way? What we want people to do? This is the really important part. If we identify that the problem that we have has to do with obesity and we need to increase the number of people within a certain healthy range of weight, then we need to identify which behaviors will actually help achieving that. A very simple one is a healthy diet and promoting a healthy diet. So if healthy diet is a core behavior that we identify, who needs to do that? What is the target population? And what do they need to do to actually adhere to a healthy diet and, as a consequence, in this case, a positive consequence, be within a healthy weight range? And when we talk about selecting behaviors, we really need to understand two different aspects. One is that behaviors are usually part of a system. So in a lot of instances, we are not only looking at one behavior, we're looking at multiple behaviors or how this behavior links with other behaviors that are part of a system to that person. So if we go back to the healthy diet example, this could be linked with doing exercise. This could be linked with people having access to medical consultations to support that, or with nutritionists. Whatever are the behaviors that are linked to this needs to be taken into consideration. And when we select the behaviors that we want to change, we really need to choose behaviors that are impactful on the problem that we identify. In this case, a healthy diet can increase the chances of being within a healthy weight. They can be changed. So we're talking about behaviors that people can actually change. They can be understood by the target population and stakeholders, and they are sustainable. When we talk about the behavioral systems or mapping of behaviors, as I said before, there are many instances where we have a more complexity link between different behaviors. This is an example from COVID-19. You can look at the paper if you want to have more information, where you can see where different behaviors related with preventing the transmission of SARS-CoV-2 are actually linked with each other, right? So you have behaviors that are related with keeping distance, with cleaning surfaces, washing hands, using masks, not touching the face, etc. And all of these behaviors will have a different impact at different parts of this mapping of behaviors and in the system. So we need to take into consideration this mapping when trying to identify the behaviors. When we have a pool or a list of behaviors that are the core ones that we think we need to address to achieve our aim in terms of the problem and the needs, we need to look at the behaviors in terms of their impact, as I said before, but also how easy they can be implemented by the target population, how likely it is that the population will adopt the behavior. We can think of a behavior that it's really important to change what we want to change in the target population, but if they are not going to adopt it, we might think of other behaviors that are more easily and more likely to be adopted. And also, if we can measure changes in behavior. Once we have this, then we can move to specifying the behavior. And there are different ways of doing. This is an example from the Behavior Change Wheel book, from an intervention looking at improving nurse hand hygiene in hospital wards. And here you can see that the behavior is specified in who needs to perform the behavior, in this case, all nursing staffs. What do they need to do differently to achieve the desired change? Clean hands using alcohol gel. This is with COVID, I think this changed a lot, but this was something that was really core a couple of years ago. When do they need to do it? During each shift, where at patient bedside, on a hospital, in each ward or unit. How often do they need to do it? Before physical contact, after physical contact, at the start of the shift, after using bathroom, etc. So you can specify in as much detail as you needed. I'm just bringing this example here from a paper that Justin Prousseau and colleagues wrote in 2019 in using a different way of specifying the behavior. So using the ACT acronym, and I think it works really well, especially in context of implementation. So it means you need to define the action, what is the behavior that people are going to do, and it has to be a discrete and observable behavior so that you can measure. Who is the actor? So who is the person or group of people that need to perform the action? The context, what is the setting? And this can be physical, emotional, or social, in which the actor needs to perform the action. What is the target? So what are the individuals that are going to be the target population, and the time period in which the actor needs to perform the action or behavior in that context. So all of them are linked, and if you go to this paper, you have really good examples. So once you establish what is the behavior or behaviors you're looking at, the behavior change wheel brings the second step. What will take to bring about change? So what are the determinants? What are the barriers and facilitators of that behavior? And here you have the wheel that I was mentioning before in a larger size. And as you can see, you have the outer layer, the gray one, that is about the policy category, so the more broader aspects that need to be in place. The red layer, the middle layer, that is about broadly what are the types of interventions that you can implement. And the green layer, so the one that is here in the inner part of the wheel, that expresses the COM-B model. And this is really the part of understanding the behavior in itself and what are the barriers and facilitators to that behavior. So the step 2 is a crucial part of the behavioral diagnostic, because it will allow you to identify what do you need to address for the behavior to change. Because when we talk about changing behaviors, when we talk about increasing adherence to a healthy diet, for example, we're talking about changing determinants of a healthy diet. We're talking about increasing the time that people have to cook healthy recipes. We are talking about increasing access to healthy food. We are talking about increasing their confidence. They can eat a better and healthier diet. We're talking about bringing social supports to support them in having a healthier diet. So what we're actually changing and addressing are the determinants of that behavior. And within the behavior change wheel, these determinants are expressed in this integrative, simple model of behavior change called the COM-B model. So what the COM-B model tells us is that for the behavior, any behavior to occur, there needs to be an interaction between three aspects, three categories of determinants or barriers and facilitators to the behavior. And these are aspects of capability, both physical and psychological capability, motivation, both reflective and automatic motivation, and opportunity, social and physical opportunity. And you can see here in this other wheel, expressing the COM-B model in more detail, that each of these aspects related with capability, motivation, and opportunity are then expressed in a more granular level in different constructs or different aspects that fit within each of them. So for example, for psychological capability, we're talking of aspects related with knowledge, memory, attention, decision processes, behavior regulation. For reflective motivation, for example, we're talking about beliefs about capabilities, intentions, goals, identity. If we move to social opportunity, we're talking about norms, social pressure, social influences. So all of this have different constructs that fit there. What the COM-B model tries to do is tell you that all the barriers and determinant and facilitators to the behaviors and to change can fit in each of these categories. And we did need to do an analysis of the categories to then be able to select what are the most important and more effective intervention types. So for example, if a person is not doing a healthy diet because they feel they are not confident to cook a healthy meal, for example, they don't know how to do it, we are not going to do an intervention that is focused on opportunity. We are doing an intervention that is focused on capability, on giving them resources on how to cook a healthy meal, recipes, explain how can they do it with the ingredients that they have. We can sometimes do it with a bit of a social support, for example, or we can bring other aspects related with increasing self-confidence. But if we don't evaluate what is the determinant, we won't be able to choose the best option in terms of intervention. So if, for example, the person really doesn't know what a healthy diet is, what does this mean? Then we need to do an intervention that is mainly focused on providing information. So it is really important that we look at the COMBI model and assess it to be able to select what we are going to do in practice. This is another representation of the COMBI model. So this is a diagram for a paper that was written by Robert West during COVID, where you can see the COMBI model expressed in a more logical, theoretical diagram. And you can see that all of these aspects in the left are types of capability, motivation, and opportunity. There are influences between them, and they all influence behavior and can be influenced by behavior in itself, of course. This is another example. So if you're doing an intervention in a company where the purpose is for employees to drink more water during the day, you have to do an analysis of what are the barriers and facilitators, in this case, more in a facilitator type, to be able to then design the intervention. So physical capability can be for the employee to be able to move from their desk to where they have a water cooler, for example. Psychological capability could be to know how to do it, believe that it's worthwhile to drink water. That's an example of reflective motivation. Feeling thirsty, an example of automatic motivation that has to do with our drives or habits. Physical opportunity, having access to a water cooler or a tap, something available in the office that it's easy to get to. And social opportunity, for example, seeing other people getting water regularly. So here you can see these examples. We probably could get hundreds of other examples. So once you identify this, then you move to step 3. And step 3 is actually going on more detail on which interventions might work. I'm not going to talk about the gray layer today. That is about the policy categories, because that gets into a bit more complexity. You can read about it. I advise you to read about it, because it is really important to know what are the more macro level aspects that you need to consider for your intervention to be more successful. But we are focusing on the red layer and the behavior change techniques. So the behavior change wheel proposes 9 types of interventions that you can implement to change the behaviors. Aspects related with training, aspects related with restrictions on access, persuasion, providing incentives, changing the environment, education, more of coercion, enablement, or modeling. And we are not making any assumptions in terms of how effective each of them are. We are saying these are broadly the type of interventions that you have access to, that you can implement to change the different aspects of the COMBI model. And then we go into more detail on the types of techniques that you can use within each of them. And it is expected that you do the desk research and you consult with your target population and with the stakeholders to identify from these types that we have access to which ones are actually more effective for that behavior, for that context. As I said before, within the behavior change wheel, there is a clear link between the COMBI model and the type of interventions. And as I was providing an example of, you need to identify which type of interventions match each aspects of the COMBI model. So here you see that if you want to change capability, then you need to have, and especially for psychological capability, you need to have interventions that are more focused on education and training. If we're talking about motivation, then aspects related with modeling, persuasion, are ones that could be, and providing incentives can be the ones that can link, if you're talking about opportunity, aspects related with enablement, restriction, environmental restructuring are the ones that are more suitable. So once you identify the categories, you can start to think about broadly what are the type of interventions that you can use for each of those categories. And then you go into more detail, as I said before. And here in the behavior change wheel, we use the behavior change techniques taxonomy and more recently an ontology to start to identify those specific techniques. And there's also other tools like the mode of delivery ontology that I'm not addressing today that can help you also in identifying how you can deliver that in practice, like face-to-face, digitally, synchronous way, asynchronous way, etc. So what are behavior change techniques? Behavior change techniques, very simply, are the active ingredients that we have within interventions. So if I go back to this intervention functions that I was showing here, you have aspects related with education or training or restriction or persuasion, but it doesn't tell you what you're going to do within each of them. It just says education very broadly. And within education, for example, we might have providing information about the health benefits, providing information about health consequences, providing information about social consequences, environmental consequences, instructions on how to perform the behavior. There are very options, very large number of options, that you can use within education. So you can go to the behavior change techniques to identify which ones you should use. So behavior change technique is really the smallest unit within intervention that itself has the potential to bring about behavior change. So for example, if you're using information about health consequences, you're saying in itself information about health consequences has some potential to bring about behavior change. Not saying you use that alone, just saying that this technique in itself is already changing the behavior. It has to be observable so you can assess it, and it needs to be replicable. It is really important that you can assess what is the measurable effect on the behavior. Because we can have a lot of active ingredients. You can think about this the same way as you think about chemical elements, because we can have so many within interventions. Researchers from the Center for Behavior Change and other colleagues around the world developed a taxonomy of behavior change techniques called the version 1, because the idea was also that this could change, could evolve according to new evidence, to new learnings within behavioral science. So it was developed by 14 international experts through Delphi consensus methods, and it provides a list of 93 clearly labeled, well-defined, and unique techniques that are organized hierarchically in 16 groupings to facilitate the way that it can be used in practice to help you navigate within the 93 techniques. And it can apply to any type of behavior. Mentioning again that we're not saying these 93 techniques are all effective in changing all behaviors. We're saying these are the 93 techniques that were found initially in the literature, that were assessed by experts, and that were considered to be the unique behavior change techniques that could be used within a given intervention. If they are effective or not for different behaviors, contexts, and populations depends on the research that you will use using these techniques. And today, you have a lot of systematic reviews, meta-analysis, primary studies, just looking at the effects of different behavior change techniques for different behaviors and target populations. So as I was showing before, these 93 techniques are organized in 16 groupings, just as an example. The first group is goals and planning, and it has goal setting for behavior and goal setting for outcome. It has problem solving, action planning, review behavior goals and review outcome goals, discrepancy between current goal and behavior, behavioral contracts, and commitment. And you have the same listing. And then for the other groupings. And then for each of them, you have a definition and you have different examples. And there is a paper that contains a list of all of these techniques. It is now translated to a few languages, including French, Portuguese. I think there was a recent one also in Spanish. So there have been some translations that different groups are making. And there's also a website where you can get training in using the taxonomy, where you can get more examples of the use of taxonomy, as well as listings of papers that use the behavior change technique taxonomy V1 in their research. It has been so widely used. I just wanted to give you this example. It has been so widely used at the moment, and the same with the combi model, and the same with the behavior change wheel. The WHO, the World Health Organization, uses commonly across their programs and within their frameworks, and the behavior change technique taxonomy also. And this is just an example of a program from the World Health Organization, that they have this initiative called Be Healthy, Be Mobile, which is basically interventions using text message to change all sorts of behaviors, physical activity, diet, for cancer, tuberculosis. If you go to the website, you'll see there are dozens of different programs and behaviors. And they develop these handbooks with a bank of messages that can be used in local, regional, and national programs to target those behaviors. And these messages are informed by the combi model and by theories of change. And this is just an example of one of the handbooks that is a program on aging, so healthy aging. And if you look at the example, this is just a screenshot from the bank of messages. And if you look at these examples of messages here, you will see on the column and the right side that says BCT number, so behavior change technique number, and then it has numbers 1.1, 4.1. If I go back, these are the numbers that you see in the taxonomy. So this means that anyone wanting to implement this program, they can easily see what they are using. So in this case, number 1.1 is goal setting for behavior. So they know this is a text message that is focusing on setting a goal for the behavior in itself. So either you can use this message or you can adapt the message using the guidelines for the behavior change technique 1.1. So this really makes it very good in terms of standardizing and providing guidance to interventions and improving the way you do interventions and making sure that you're using the technique as it is intended to be used. But also, it is really important because it allows for evidence synthesis, because if this information is all available, we can easily check what is the evidence synthesis associated with the effectiveness of a given behavior change technique for a given behavior. So how do you select a behavior change technique? You can identify from this 93 that exists. There are other classification systems. For example, there's one on self-enactable techniques. There's one for motivational interviewing techniques. There's one for self-determination theory-based techniques, etc. But how do you go about and select a behavior change technique? There are different ways. So in one hand, you can use a criteria that was developed as part of the behavior change wheel, which you can have a look at in the references. I have no time to go into that, but it's called the APAS criteria that looks at how affordable, how practical, how easy it is, what are the side effects, etc., of each of the techniques and interventions. So it is a way of assessing if that technique and interventions are the best to be implemented within that package of your intervention, using evidence-based behavior change techniques, as I said before, and also it will depend on the source of the behavior. So the combi model, or more broadly, the different barriers and facilitators and mechanisms of action. So if you talk about identifying evidence-based behavior change techniques, there are different ways in which this has been done. So there's experimental manipulation of behavior change techniques, people using observational studies, meta-analysis, meta-regression, other types of reviews. So there are plenty of different approaches, methodological approaches to identify BCTs, and a lot of papers published with that information. Depending on what you're interested, you will find that in a search in the typical databases that we use. Some examples here: a meta-regression on behavior change techniques using in digital behavior change interventions for alcohol consumption, behavior change techniques for physical activity and healthy eating in overweight and obese adults, and another example of a systematic review looking at behavior change techniques in digital interventions for type 2 diabetes prevention. On the top of using the combi model to identify which techniques link with the combi model, and if you go to the behavior change wheel book and references, there are links between each aspect of the combi model and all the techniques, or at least the most commonly used techniques. But you can also use this tool. This is called the Theories and Techniques tool. It's available online for free. It was developed as part of a project called the Theories and Techniques project, and then later as part of the Human Behavior Change project. And if you go to the tool, it's a dynamic tool. You will see on the left side a list of behavior change techniques. It doesn't have the 93. It has a smaller set, but it's still a big set of behavior change techniques. And you have a list of mechanisms of action. So aspects related with knowledge, with skills, with capabilities, with optimism, all of those elements that constructs that I described before are here in the list of mechanisms of action. I think it's 26, if I'm not mistaken. And then you have links between the behavior change techniques and each of them. So if you look here at the table, everything that is in green is where we have enough information to say there's a link between that behavior change technique and that mechanism of action. And the links derive from both the literature and expert consensus. In blue is when we have enough evidence that there is no link between them. In yellow is that when we don't have enough confidence, so it's inconclusive. And blue is when we don't have evidence at all. So inconclusive is when we have from one source but not the other, and no evidence is when we really don't have any evidence to support the links and understand the links between them. So I'll just give an example. You have knowledge here, the first one, when it has a K and an N is knowledge. And then on the left side, you have the behavior change techniques. You can see, for example, that there's no evidence that goal setting or problem solving will increase your knowledge. There is evidence that goal setting, outcome, or action planning have no link with increasing knowledge. But for example, providing feedback on behavior is inconclusive. Then if you move to others, for example, beliefs about capabilities, where you have the BCA, problem solving as a link with beliefs about capabilities. So if you scroll around the tool on the website, you will see where there are links or no links, and this will help you in identifying which behavior change techniques could be more important. If you start looking at papers using the behavior change wheel, this is what you will find, bringing all the steps together. So you will find these tables that describe how you move from the beginning to the end. And in this case of this table, this is for an intervention on reducing sitting time in the workplace. You will see here on the left side for capability, what are the aspects, the barriers or facilitators related with reducing sitting time within psychological capability. And then in more detail, this is expressed in knowledge, memory, behavior regulation, etc. If you scroll down the table. And then based on the identification of the combi aspects, there is an identification of the types of interventions, and then more specifically, which behavior change techniques fit in each of them. So I'll just go to the first one, education. You have this different type of techniques, information about health consequences, feedback on behavior, feedback on outcomes, prompts and cues, and self-monitoring of behavior. And then, of course, you describe how you do in practice. And this is the rest of the table, not going to go into detail, but you can see that the same thing was used for all the other aspects of the combi model. So you move from identifying capability, opportunity, motivation. You go into more detail on what are the constructs within each of them. You then identify broadly what are the interventions that match these aspects. And this is given to you in the behavior change wheel framework. So the links are all there. You just need to go and check the links. And then you go into more detail and identify, okay, for each of them, which techniques actually can be used. And for these techniques that can be used based on evidence, based on the co-creation with your population, based on the tools that are available, then you make decisions of the techniques that you will implement in practice. Just very briefly, I wanted to draw your attention that recently we develop an ontology of behavior change techniques also. And this is within a project called the Human Behavior Change Project, where we developed, and we're still finishing developing. This is a project that is led by the Center for Behavior Change, with Susan Meeke as the principal investigator of this project. And one of the aims of the project was to develop ontologies to describe all components of behavior change interventions. So it's expanding and improving the work that has been done so far with taxonomies to develop ontologies that are better in terms of formalizing knowledge. They are machine readable, so they bring some advantages in relation to the taxonomies that we used before. And if you're interested, just go to the website of the Human Behavior Change Project to get more information. What I just wanted to draw your attention is that as we are developing ontologies for each aspect of the intervention, we also developed an ontology for behavior change techniques. If you go into these papers, you will see in the first paper the rationale for why and how we did that, and in the second paper the description of the new ontology. But I'll just provide a very brief example. So the taxonomy has been widely used, is really helpful. It provides a list of these 93 techniques, but it is a version 1 because we knew, and you know, the researchers that developed the taxonomy initially knew that there will be more knowledge to come in behavioral science, and it would have to be improved at a given point in time. And so from feedback from different aspects, from interventions, from different sources that were conducted, there was an online portal that was open for feedback for people using the taxonomy. And from all of these sources, it was realized that there were some limitations in the taxonomy. There were some techniques that were missing. Some techniques were not at their lowest level. As I mentioned before, each technique needs to be unique and at the lowest level. Some of the techniques actually had more than one technique in itself. The groupings were not well defined. They were not logical. And because it was a taxonomy and not an ontology, it was more strict in terms of dynamic relations, and it didn't have the possibility to be read by machines. And it's really important that we have these classification systems to be in a language that machines, computers can read it, so that we can accelerate the accumulation of evidence and improve our science. So just a very specific example. In the taxonomy V1, we had a grouping called social support that includes social support unspecified. That's when we don't have enough information to know what kind of social support is being used. Social support practical and social support emotional. In the ontology, this was actually broken down in 12 techniques. If you look at them, it can sound very complex, but if you look at them, they are actually similar in terms of 3 areas. So one is advice, one is arrange, and one is deliver. So one is advise the person to seek social support. The other one is arrange support for the person or group. And the other one is delivering the support. And then within each of them, we have 4 types of support: instrumental, emotional, informational, and appraisal. This comes from theories of social support. This allows us to end the social support unspecified, and allows us to give people more possibilities to choose what is the type of social support technique that they actually need to implement in their intervention and to better report it. Are they advising the person to seek support? Are they actually arranging support? Or are they delivering the support? And what is the type of support? So the ontology now has 281 techniques opposed to the 93, but it's mainly because they are breakdown and they are organized in a more logical and better manner for people to use it. And they have 20 groups now and 5 hierarchical levels. And in the paper, you will find information about all the groupings. Each groups have their own definitions, which techniques fit there, what are the different levels, examples. There will be more tools available through the Human Behavior Change Project website and Open Science Framework Project, and in the website of the ontology that we have developed that provides more examples, more illustrations of the different types of techniques. So this could be quite useful. An example, there is a group called goal-directed behavior change techniques. And you can see here that it contains aspects related with advising to keep a certain goal, revising a goal, setting graded tasks, action planning. Goal setting also is divided now in agreeing different or setting different types of goals, advising goal integration, and so on and so forth. So if you explore the ontology, you'll see advantages. This is not to say that you can't use the taxonomy anymore. This is really to say that on the top of the taxonomy, there's also the new ontology that goes into further detail, and that also fits with the behavior change wheel. So you can link the combi model again to the ontology because it is all being mapped. So just to sum up, in relation to the techniques, this is really important to use these classifications of behavior change techniques because they allows us to describe and report interventions better, improve evidence synthesis, develop and evaluate interventions, identify research gaps, discard behavior change techniques that are actually not effective, advance theory, and there are a lot of advantages in using classifications of techniques and modes of delivery, etc. So to finish, I would just like to say that the key message from this module is really the behavior change wheel framework is one of the frameworks that you can use complementary or standalone or complementary to other frameworks that you are learning as part of this course and these different models. For example, if you have heard about the MOST framework, we recently published a short paper looking at how the different frameworks can be integrated with the MOST framework, and there's some ongoing work on that, on thinking how we can integrate the classification of techniques. So different frameworks can be complementary depending on the purpose, or you can use as a standalone. The behavior change wheel has the advantage of being easy to use for people that are not psychologists to be used in practice, to explain to others, especially the combi model. It's really easy to understand and to integrate, and it's really important that people are able to put things in categories. And it also provides you guidance on how things are linked. How do you go from identifying a behavior, identifying its barriers and facilitators, identifying the interventions that can change those barriers and facilitators, and then which techniques can be implemented in practice. I hope this module was useful for you, and thank you.